All right, good afternoon, everyone, and welcome to today's Intro to ECHO webinar, or informational as I'd like to call it. Thank you all for joining. My name is Kevon, and I am the MACS TeleECHO Coordinator. Myself, along with MACS TeleECHO Consultant, Dr. Bethany DePaula of the University of Maryland School of Pharmacy, will give you an overview of the ECHO model and explain how MACS utilizes the model to enhance the MACS mission. I do want to make everyone aware that this session is being recorded. I'll go ahead and share my screen and bring up today's presentation. At the conclusion of today's presentation, learners will understand the 4 key principles of the ECHO model, which are amplification, best practices, case-based learning, and how to monitor outcomes, how ECHO differs from traditional telemedicine, along with how MACS utilizes ECHO to enhance its mission. As we get started today, I do ask for attendees to direct any questions to all panelists via the chat box. I'd like to start by briefly introducing our MACS ECHO consultants, Drs. Devon Gandhi, Michael Fingerhood, Bethany DePaula, Eric Weintraub, and Christopher Welsh. Our dedicated ECHO consultants join each ECHO session and provide expert recommendations to our learning community. While we have a dedicated MACS ECHO consultant team, we also have additional MACS consultants who support MACS more broadly in our mission to provide support to primary care and specialty prescribers across Maryland in the identification and treatment of substance use disorders and chronic pain management. MACS offers a host of services, which include providing free phone consultation for clinical questions, resources or referral information, offering education and training opportunities related to substance use disorders and chronic pain management, technical assistance services, Project ECHO, assisting in the identification of addiction and behavioral health resources that meet the needs of the patients in your community. All services are available free of charge, regardless of your patient's insurance status. I also want to add that MACS services can be requested by calling our warm line at 1-855-337-6227, Monday through Friday from 9 a.m. to 5 p.m. You may also email macs.echo@som.umaryland.edu, and you may also sign up for our newsletter via our website, www.marylandmacs.org. Next, I'd like to go over a Project ECHO overview and discuss moving knowledge instead of patients and providers. We'll do that by watching a short video which features Project ECHO founder, Dr. Sanjeev Arora.
I'm a specialist in liver disease. I used to run a dedicated hepatitis C treatment clinic in the university. Some patients would travel 200, 250 miles each way to Albuquerque to see me.
He's used diuretic therapy.
I found it extraordinarily frustrating that some of these rural patients would come to me at too late a stage. I always had that nagging thought that if I had just been able to treat them earlier, I would have been able to prevent this problem.
If you're in a remote area, the specialists that I need and that Ashley needs, we don't have those specialists. We'd be traveling once a month out of town, quite a ways.
Squeeze nice and hard for me. as a rural physician, I'm not exposed to the constant didactics and grand rounds and M&Ms that a physician in an educational institution is getting.
So we came up with this ECHO model with the idea that if I could get rural clinicians who would be willing to be mentored by me, then permanent addition of capacity will occur in these rural areas. We use technology like video conferencing.
Recommending end of treatment viral load and 6-month post.
We started with hepatitis C, and then we realized that patients with substance abuse disorders were not getting good health care in rural New Mexico because there were no experts in that area. We had experts in Albuquerque, so we said we would echo them. One thing led to another. After that, we started a diabetes program. Now we have echo projects in 19 separate areas. Every day we have a different echo project going on.
She's a physician assistant, and she's actually also interested in the pain echo.
The primary purpose in Project Echo is not to treat individual patients. The primary purpose is to build expertise. Go ahead, Angela.
Thank you, Dr. Baker. Patient LO is a 39-year-old patient.
Over the last 20 years, I recognized what are we going to do with this massive number of people that have to be seen by us. And fortunately, through the ECHO program, I can finally access these people.
So why don't you just hold the hydrochlorothiazide?
Okay.
Let's stay on everything. A local ophthalmologist started sending me a whole bunch of patients with possible Sjogren's syndrome. And I'm sitting there on the computer going, okay, I know what Sjogren's is, but how do you work it up and what do you do? And it just sort of started from there. But I did do a full autoimmune workup on her, which was all negative, including during the sessions, I'm able to make suggestions and ask questions or clarifications, even if it's not my own case. It's a giant mind center of collaboration.
She has some pretty significant contractures in her right hand.
Video interface allows us to build what we call a community of practice. That is, there is collegiality, the same as you experience when you're doing rounds in a hospital.
Dr. Bankers, would you consider compression stockings, thinking that this could be an element of post-Levin syndrome?
Well stated, Madhu. What do you think, Naomi?
Well, she doesn't have edema per se, but
It is best practices all over the state to these sites. And mind you, these providers are really talking like they're rheumatologists. They know all the lingo, they know all the therapies, and it's very gratifying.
The primary idea in Project Echo is something which we call a force multiplier. Every one patient that is presented, many more patients benefit because the expertise of the clinician increases, and this enhances quality of care.
how are the knees doing?
Knees are good.
Are good. Okay, good. The more I know about rheumatology, the more I recognize it in the clinical setting. And the more people I'm diagnosing, this also opened up an entirely new field to me. I'm now getting referrals from other physicians at the hospital.
We started Project Echo in New Mexico just for rural areas and prisons. But then our urban sites wanted to join us. And so we said, yes, do it. University of Chicago has Project Echo going on for treating hypertension in African Americans. In the University of Washington, they now have 20 sites. The care that these doctors provide is as good as we provide in the university. It's as safe and it's as effective. We've been able to demonstrate conclusively that the model works.
The primary goal of MACS Project ECHO is to develop a capacity to safely and effectively treat OUD in all areas of Maryland and to expand access to care. With that said, we'll now go into the key components of the ECHO model. The first being amplification of technology, using technology to leverage scarce resources. The next, is to be able to share best practices to reduce disparity. The third is case-based learning to master complexity. And the fourth, web-based database to monitor outcomes. I'll now hand it over to MACS TeleECHO consultant, Dr. Bethany DePaula, to explain the components of a TeleECHO session.
Thank you. So this is a summary of what you can expect at each session. We always start with an introduction. Again, as Dr. Aurora mentioned, we're trying to build a community and have a relationship. And so while we don't require it, we do request, if you can, to have your camera on like we do today, so we can put a name with a face, but each of us will go around the room, introduce ourselves. We then move to the case presentation. This is a case that is going to be brought by one of the community members, and they will go over the specifics of the case. Next, we'll move to a clarifying questions. This is opportunity for both community members and consultants to ask any questions that they might have so that we can move to recommendations. This is the discussion component. This is where we're all going to learn together and come up with a brainstorming session of possible suggestions. Those suggestions will be summarized at the end of the case, and they will be shared specifically with the community presenter after the fact in writing. Then we move to our didactic section. Our didactic section is basically a planned in advance presentation. They're generally about 15 to 20 minutes long, and the community and other consultants will have the opportunity again to ask questions at the end. After the session is over with, all attendees will receive an online evaluation that we request you fill out. Next slide. The case presentations are the heart of Project ECHO, as Dr. Aurora mentioned. These case presentations do not have to be complex. We love when you bring something that's complex. That's great. Gives us lots of opportunity for discussion. But it can just be a case that you saw that you thought was interesting, had a good learning point, something that you see on a regular basis that you want to share with others. The main point is that we will provide you with a form, and the form makes it very easy for you to put the case together. We're not expecting you to put everything together for scratch. And we ask that you return the form within 1 to 2 days before the clinic so that we can review it, because this needs to be de-identified. We want to make sure that there's no protected health information. And we will distribute the case to the other community members. Next slide. The benefits might be obvious, but what are you going to get out of this as a clinician? First, you'll receive CME and or CEUs. However, I think really probably one of the greatest benefits is the opportunity for professional interaction. I think especially with everything going on right now, many of us feel pretty isolated. And this is a great opportunity to interact with colleagues, build that community, all of which have similar interests. It's a mix of work and learning, so it's all teach, all learn, which is great. And it's going to give you access to an interprofessional team, which many of us, when we practice routinely, don't have that. So there's going to be specialty consultation with addiction psychiatry, with internists, with pharmacists, with behavioral health specialists, all working together. Next slide. Dr. Aurora alluded to this in his video, but traditional telemedicine is different than the ECHO model. In traditional telemedicine, the emphasis is one specialist managing a patient or a patient practice. We are trying to expand care to throughout the state of Maryland, and we do this by having a team of consultants working with community-based providers, and that allows for patient care for many, many more patients and a more specialized care than they might receive outside of this type of model. Next slide. Project ECHO does look at their outcomes data and the benefits of how echo may work in different settings. And so this is actually a summary from a publication that was published in 2016 and was specifically looking at echo and substance use disorders. And they found that, first of all, over 950 patient cases were discussed, which is fabulous, but that this led to a successful increase in the availability of Data 2000 waivered prescribers. So prescribers that could prescribe buprenorphine to manage patients with opioid use disorder. Next slide. MACS TeleECHO clinics are scheduled to start in January. They're going to be the third Wednesday of the month, running from 12:30 to 1:45 p.m. Again, the community is required, one individual from the community each month is required to present a case. We will have a sign-up list so you know when your month is. And then we will be offering a curriculum, as I'd already mentioned, and the pre-planned curriculum is listed in this particular slide. We'll have either consultant speakers or guest speakers come in and cover each of these topics. Next slide.
Thank you very much, Dr. DePaula. I do want to thank you all for your interest in MACS TeleECHO, and I just want to remind you that registration is currently open and information can be found on our website at www.marylandmacs.org. I'd also like to remind everyone that you may request any of MACS's services by calling the warm line at 1-855-337-6227, Monday through Friday, between the hours of 9 a.m. and 5 p.m. You may also find more information via our website at www.marylandmacs.org. Right now, I'm just going to check the chat box just to see if there were any questions. It doesn't look like there were any questions right now, but feel free to send us an email or visit our website. We're always available to answer any questions. If you're interested in registration, we can also assist with that. Thank you all and have a wonderful afternoon.